Today, the University of Minnesota Medical School released its annual Adolescent Sexual Health Report. It's the first look we have of teen pregnancy trends in Minnesota during the pandemic. Heidi Wigdahl explains what they found.
The U of M Medical School's Healthy Youth Development Prevention Research Center released its annual report on the sexual health of the state's youth. It gathered data for people ages 15 to 19. Sexually transmitted infection rates went down in 2022. However, although Minnesota youth ages 15 to 19 account for only 6.5% of the population, they account for 24% of the chlamydia and 14% of the gonorrhea cases in the state in 2022.
Is it actually going down, or are we seeing less testing happening among all people, but I think especially young people?
Jill Ferris, director of adolescent sexual health training and education at the center, says it's probably a bit of both. Meanwhile, the pregnancy rate among 15 to 19-year-olds increased by nearly 26% from 2020 to 2021, while the birth rate decreased by 3.3%.
Usually these two trends follow each other. This year, the birth rate went down slightly, but the pregnancy rate actually went up. And so what that suggests to us is that more young people decided to terminate pregnancies in that year of 2021.
The report includes recommendations for supporting youth, stressing the need for access to education and services.
But it definitely does sort of beg the question of what young people had access to during the pandemic. And what it really seems like is that young people probably continued sexual relationships and continued having sex, but access to contraception and condoms might have been lacking. How can we, look at this information and provide and create services and programs that really fit the needs of young people, but also are following the data and following the trends and what the trends say we should be doing?
While overall pregnancy and birth rates in the state remain historically low, there are disparities. For example, youth of color have higher birth rates compared to their white peers. Also, birth and pregnancy rates are higher in greater Minnesota. Julie.
All right. Thanks, Heidi.